Hi, my name is Dr. Shaina. Today we're going to talk about imaging. The question is, can we rely on MRI to tell us where our pain is coming from? I've had patients come in that have been told they have bone on bone in their joints. Patients that have come in that are younger and have been told that their spine is like an 80-year-old spine based on imaging. I've had other patients who've been made to feel that they have a fragile body after they saw the results of their imaging that just shows thing after thing, lists in terms of things that are abnormal and what feels like damage. Other patients that come in and have been told to mainly rest, and they're not better after resting, or they're even feeling worse after resting. I want to talk about some studies that show us a little bit about how MRI itself can't be the main determining factor of where our pain is coming from. One study looks at asymptomatic individuals that have had MRIs of their spine, and they are of the ages between 20 up to about 80 years of age. One study looks at about 33 articles, and it looks at asymptomatic patients who have had imaging, particularly MRIs of their spine. These imaging findings presented disc bulges, disc protrusions, spondylolisthesis, facet degeneration, all sorts of things, stenosis, and they have all been asymptomatic. None of them have pain whatsoever. What it showed was from the age of 20 to 80, the prevalence of these conditions actually do increase, but everyone in this study had zero pain or symptoms whatsoever. So it kind of just shows us that some of these conditions are just a part of normal aging. Does it mean that you'll have pain? Not necessarily. You might just see an imaging results and see a ton of things, but the patient is standing there functioning completely fine and they have no symptoms whatsoever. So you can't just look at a piece of paper to tell you how the person is doing. There's another study that looked at knees on patients, MRIs of knees. The study showed osteophytes and cartilage damage and bone marrow lesions that happen to be really common in middle-aged adults. There's the same prevalence of these types of findings, both on asymptomatic people as well as symptomatic people. Again, it shows that it's just kind of a sign of normal aging. Does it mean that if you have it, you'll have pain? Not necessarily. It's just that process. Another study looked at MRIs of someone who has shoulder pain, but they looked at MRIs of both shoulders, both the symptomatic shoulder and the asymptomatic shoulder. What it showed was in most conditions, let alone a couple, in most conditions, it was just the prevalence of those conditions were just about the same in both shoulders, both symptomatic and asymptomatic. One more study we're going to talk about today looked at one patient in the span of 3 weeks. She went to 10 MRI centers, got 10 MRIs of her lumbar spine, and the findings of that were 0 findings were the same in all of those 10 examinations. One finding was the same in about 9 of those examinations. So there's poor agreement on interpretive findings between all of those examinations. And that was on one person within the span of 3 weeks on the same body part. It was just different centers and different radiologists. So in conclusion, you can't just look at results of an MRI and expect to know exactly what the patient is feeling or whether or not they even have symptoms. You can't tell just looking at the paperwork or looking at the image itself why the patient is having pain without also doing an assessment on the patient themselves, getting a bit of the subjective and the mechanism of injury and how they present to correlate with those findings together. MRIs are really great at looking at serious conditions and checking for serious conditions like tumors or other space-occupying lesions, but it doesn't necessarily tell us directly on its own what's causing us pain. So if you get imaging and you find a slew of abnormal findings, try not to jump to the conclusion that you are fragile, that you are weak, that you have to stop doing everything because you have all of these findings. Sometimes it might just be normal aging, and sometimes it may not bother you at all. If you hadn't gotten the imaging, would you have even known if you have no symptoms at all? So really believe in the resilience of the body and the power of the nervous system. If you do have pain, then go get assessed. The assessment should not just be imaging itself, but it'll be an evaluation, an assessment, seeing how you move, seeing how the pain started in general, even if it was gradual or if something happened. All of that has to correlate to building your plan of care to make you better and make you doing the things that you love to do.